Hey, I'm Dr. Yash, a board-certified plastic surgeon in Dallas, specializing in rhinoplasty and facial surgery. And I sit with patients every week who hit day 2 after their rhinoplasty and think they made a mistake. And let me tell you something. The patients who walk out of my clinic completely happy with their nose understood a few key things before I ever touched a scalpel. In this video, I'm going to walk you through the top 6 things you need to know before getting a rhinoplasty. So if you're seriously considering a nose job, watch this video before booking your surgery. So the first thing you need to understand is that rhinoplasty is not a copy-paste surgery. Everybody has different anatomy, has a different shape to their nose, and then everybody also has a different goal for their nose. For our nose, we have paired nasal bones, paired middle cartilages, paired tip cartilages, and a septum that separates everything. And then all of that is encased in this thick, soft tissue layer, a little bit of fat, a little muscle, and then the skin layers as well. Everyone is different. There are intrinsic differences from one patient to another. Some of the cartilage and bone is weaker in some patients. Some of it is stronger. Some of it is thicker. Some of the shape is a little different. Some have a barrel, some have a more of a narrow structure to their nose. And then there's some congenital differences as well, where there's a deviation to the septum in a very complex way. Some patients may have had a prior rhinoplasty that's also affected everything. Some patients get fillers to their nose that affects the soft tissue. So you can understand there's a lot of variation from one person to another person. And then to kind of expect that we're all going to have the same result is just not realistic. And so when patients walk in and they have a celebrity's nose, as like a photograph or a nose that they want to have, that's just not the right way to approach a rhinoplasty. I always encourage patients to bring in goal photos because I do think that's important, but it's not so much about the person and their nose. It's really about what aspects of the nose they like. And it's kind of a starting conversation for us. And so we'll talk about that. Why do you like this nose? What do you like about this? Or what do you not like about this? And it gets the conversation started. And then we always translate back to their nose. And that's what's most important. Let's talk about your nose, top 3 things you don't like about your nose, and let's talk about the goals that you want to have. With every consultation, we have to do an examination, have to look inside the nose to better understand, can their goals be actually met with a rhinoplasty surgery? A well-executed rhinoplasty is a balanced version of yourself, not someone else's nose. The goal of a rhinoplasty is to harmonize the nose and the face. Nasal-facial balance is super important. And I think that makes the operation even harder when you're trying to achieve that. And I think that is the first thing you really need to understand. Rhinoplasty is not a copy-paste surgery. And that brings me to point number 2. Natural results are actually harder to achieve in rhinoplasty. So I do a lot of rhinoplasty. I do primary rhinoplasty, where it's the patient's first time they're having a nose job. I also do a lot of revision rhinoplasties where they've had a rhinoplasty done elsewhere many years ago and they're coming in to fix it or revise it. And I'll tell you, in these revision rhinoplasties, the biggest thing that I always see is that patients have an overdone rhinoplasty. The prior surgeon has taken away a lot of their anatomy, their cartilage or their bone, and we're trying to rebuild and restructure their nose. So what I'll tell you is that a natural result is not an easy thing to do, and you have to portray a lot of restraint as a rhinoplasty surgeon. When I'm doing a surgery, every single step from the initial cut to the maneuverings, to the stitch work, to the repositioning, all that is very criticized from my point of view. And I'm being very careful not to overdo something or not to underdo something. So for me, at the end of a 3.5-hour rhinoplasty, I'm mentally exhausted because every single step that I'm doing, I'm mentally thinking, is this going to get me to the end point that this patient wants? And I think that's the real skill in a rhinoplasty, is understanding that balance so you can finally get that natural result. Nasal facial balance is super important, also super hard to achieve. But when you approach a rhinoplasty from that perspective, I think that's the key. An overdone nose, at the end of the day, not as hard as a natural result, because you're kind of forgetting the principles of nasal-facial balance and you're just kind of focusing on the nose, trying to get to a copy-paste result, essentially. So if you're trying to judge which surgeon is going to have this skill set or this philosophy, I think it's really important to do your homework. Look at their website, look at their gallery, look at their before and afters. Do you think this patient has really focused on a nose that balances with the face? Or is it kind of all the noses look the same? When you look at my results, my social media, my website, you'll realize every nose is a little different. And I think that's super important. I try to achieve a nose that the patient wants so it fits their face. I'm not trying to give everybody the same nose. There's no Dr. Yash nose. It's your nose the way you want it. And I think that's really important to understand when you're considering to get a rhinoplasty. So let's talk about point number 3. The airway is not a cosmetic afterthought. What does that really mean? So most of us who are considering a rhinoplasty will understand there's a function aspect to a rhinoplasty, how you actually breathe, and then there's a cosmetic aspect, how you actually look. To me, in my philosophy, function and aesthetics are not mutually exclusive. They actually relate to each other. So if you're trying to breathe better, your nose is going to look a little different as well after that surgery. On the other side, if you're trying to change the way your nose looks cosmetically, your breathing could be affected as well. And I think as a surgeon, I have to really understand both aspects and marry them together. So for any patient that's coming in, wants to get a cosmetic change to their nose, I have to protect and make sure that they can breathe the same or if not better after surgery. So understanding a little bit of the anatomy, the airway really has 3 anatomic zones to me. There's an external valve, which is kind of that first point where the air hits your nose externally. There's an internal valve, which is really a relationship between the septum, a type of cartilage called the upper lateral cartilage, and your turbinates. And then there's obviously the septum as well. So when patients get an isolated septoplasty to affect their breathing, in my opinion, the surgeons are forgetting the 2 other anatomic zones that could be improved to help your breathing. When I do a rhinoplasty, regardless of function or cosmetic, I always focus on all 3 zones. And I focus on supporting the internal valve, supporting the external valve, and addressing the septum. Now, believe it or not, all of us have a little intrinsic deviation to the septum. Having done a lot of rhinoplasties, I tell you, 1 in maybe 20 or 30 patients have a perfectly straight and strong septum. Everyone's got a little difference to their septum, a weakness, a little deviation. The cartilage and the bone interface can be a little off midline sometimes. And when you don't address that, you could lead to some problems later on after your surgery. So I address the nose from both a functional and a cosmetic perspective because they're not mutually exclusive. So let's get to the 4th point, which I think is super important to understand, is that healing after rhinoplasty takes a long time and you have to be patient. So obviously after surgery, you have splints and stitches, all that comes out at week number 1. The nose you see at the first week is not the nose that you're going to get at the end of the first year. And there's a lot of recovery that happens. Bruising typically is gone by that first week for my patients, given the approach that I do, but swelling is real. And for some people, swelling can last for several months. For some patients, swelling only lasts for maybe a couple of weeks to a few months. And a lot of that is a difference in our body, our anatomy, our soft tissue, how thick our nose is. Do we have a lot of sebaceous hypertrophy in our nose? So like I said, the variation is there, but at the end of the day, the healing could be a long period of time. And you really have to trust the process and not allow yourself to get into an unnecessary panic state early on in your recovery. Now, I think what's really important is that you establish a relationship with your surgeon. That's really important because the rhinoplasty recovery, obviously there's a physical aspect to it, but there's an emotional, social aspect to it. And if you haven't gotten that kind of support system from your surgeon or your surgical team, then it can be a scary process for you. It could be a roller coaster. Some days you're feeling great, you're looking great. And some days when you have a little bit of swelling, you're not feeling so great. And that could be really heavy for you to handle. In today's day and age, we put a lot of pressure on ourselves, how we look, and we make this major emotional decision to get a rhinoplasty. And if you're not taken care of during that recovery process, it can be a little tough on yourselves. Little things can affect your swelling realistically. If you went out last night, had a few drinks, if you went out for dinner, you had a really salty meal, all these things can really affect how your nose swells. If you're working out and you're going really hard for a few days in the gym, that can affect your swelling. Or let's say you live in a really hot city. It's really hot outside in the summer, you're going to the pool, maybe you're at the beach. All these things can affect your swelling. That's normal. And you have to understand that. You have to communicate with your surgeon so they can kind of coach you through this process. It's a full year of recovery. And the swelling at the tip goes down the last, but you have to trust the process. And that's really important to understand. And that leads me to my 5th important point to understand. the surgeon matters more than the technique. When a lot of people are researching rhinoplasty, they're going to research the technique. Open versus closed, piezo versus preservation, open structural, and there's a lot of variety out there. And in my opinion, it's not so much the technique, it's more important to understand the surgeon. Research the surgeon, know what their training background is, know whether they focus primarily on rhinoplasty, for example. Look at their reviews, read what patients are saying about them, read about not only their results, but about the patient's experience, were they taken care of, were they attended to properly. I think this is really important to understand when you're trying to choose your rhinoplasty surgeon. There are a variety of techniques, as I mentioned, in rhinoplasty. And what's not important is the tool, but is how the surgeon puts it together. Do they have the skill set to exhibit that restraint that I mentioned before, to use these tools to carefully get your nose to that endpoint? Do they have the aesthetic eye to help give you that nasal facial balance that I think is so important when doing a rhinoplasty? Now, when you go to a consultation and you are trying to figure out whether this surgeon is the right surgeon for you, what are some questions you can ask that person so you can better judge and understand whether this is the right place to get your rhinoplasty? I think the first thing is you have to get to know that surgeon and you have to feel connected to them. If you don't feel that they understand the result that you want, they probably don't. And they're probably not a good surgeon for you to go with. What's really important is you feel that the surgeon understands the result you're looking for and that they can deliver it. That's the first thing. If you have that gut feeling, that's great. The second thing you can ask them is, how many rhinoplasties do you do in a given week? Third thing you can ask them is, how many times do you have to revise your own rhinoplasty results? That's fair. Most surgeons should have an idea about what that number is. If they don't, maybe they don't do a lot of the rhinoplasties, or maybe they don't really know. And I think that may be a little bit of a red flag, because any surgeon that really cares about their results will always analyze their results and know these numbers as well. I think it's super important to ask a surgeon, what if I don't like my result? What is the process like after that? I think that's really important. It's really honest, but I think having that conversation with the surgeon will help you understand whether they're the right surgeon for you. And then ask to see some of the surgeons before and afters that are kind of similar to your own results. And so you can have that conversation about how this patient got to that endpoint and whether that's realistic for you to actually achieve. At the end of the day, I think the number one question you have to ask your surgeon is, do I have realistic expectations? And I think that may lead you to being a little vulnerable, because I think what's really important is for the surgeon to tell you whether or not your results are achievable and whether you have a realistic expectation or not. I think at the end of the day, having that transparency and that honesty with your surgeon is really important in establishing a relationship as you walk into getting a rhinoplasty and embarking on that first year of recovery. And that leads me to my sixth and final point. Who should wait before getting a rhinoplasty surgery? There are a couple kinds of patients if you really think about it. The first one is someone who doesn't truly understand what they want. If a patient comes into my clinic and they can't articulate exactly what they don't like about their nose or what they want to see change for their nose, how can they expect me to actually do it? They have to be able to articulate it very clearly. Now, in some cases, I'll coach the patient and I'll tell them, okay, let's break it down. Look at your nose in 3 different zones. What do you see? What do you like? What do you not like? Even after that secondary coaching, if they can't truly articulate, I don't think they're a good candidate for the surgery. And I'll actually tell them, go back home, think about your nose a little bit more, think about what you don't like, what you do like, and then give yourself some time and come back later on. And let's see if that changes. That's really important. So you got to know what you don't like and what you like about your nose, first of all. Sometimes some patients are also seeking the surgery for external reasons. So someone else, a family member, a significant other, tells them, I think you need a rhinoplasty. I think you need to change this about your nose. Doing a rhinoplasty for someone else is never the right thing to do. This is your nose. It's very personal. It's your personality, but believe it or not. And you should never do a rhinoplasty for somebody else. So if a patient comes in saying that, someone else told me I need a rhinoplasty for X, Y, and Z reason, I'll tell them this is not the right thing for you. And having that conversation is not easy. As a surgeon, it's super easy to say, sure, let's do rhinoplasty. You have a nose, I have the scalpel, let's do a rhinoplasty, but it's not that simple. And I can't tell you how often I hear patients say, oh, the surgeon that I went to before never looked in my nose. I think that's crazy. I think as a surgeon, I have my own checkpoints that I have to make sure that the patient is ready to undergo the surgery. I can do the surgery. If I don't think they're ready, I have to tell them. Otherwise, at the end of the day, a happy patient is not a good looking nose. It's a happy patient that likes their nose. And I think understanding the difference there is super important. So I think the sixth point is probably the most important one as well. You have to have realistic expectations. And if you don't, you shouldn't get a rhinoplasty quite yet. And that doesn't mean you may never get a rhinoplasty. It just means you need to educate yourself a little more. You need to do your research. You need to talk to people that have had a rhinoplasty. And you need to talk to the right surgeon who can actually educate you on what is a realistic expectation or what is not a realistic expectation. And I'll tell you this, if you're using the word perfect in your description, you're probably not the right patient for a rhinoplasty. Rhinoplasty is an art and science. And there's a variation to everything, not only from your anatomy to the surgical technique to your healing. And if you're expecting perfection, I think you're going to let yourself up to being maybe a little unhappy at the end of the day. Now, as a surgeon, I strive for perfection every single day in the operating room. And that's why I get up and I go to the operating room and I mentally exhaust myself in surgery because I want to make sure everything comes out as perfect as possible. But to expect a perfect result every single time as a patient, it's not realistic. Now, what is realistic is seeing improvement. And I think that's where the focus should be. Understanding you don't like something about your nose is important, and then expecting an improvement is the way to go. How much of an improvement? I think that's where the conversation is. That's the difference from surgeon to surgeon. And then I think it's important to have that conversation so you can have a realistic expectation at the end of the day. And that is really the foundation of a rhinoplasty result you will be proud of for the rest of your life. It's not about the photo you bring in or the technique your surgeon uses. It's about getting in with grounded expectations, a real conversation about your anatomy, and a surgeon who truly cares about how you breathe as how you look. If you're ready to take the next step and want a personalized evaluation where we look at your specific nose, talk you through what is actually realistic for you, the link to book a consultation is right below in this video.